Here's how to differentiate transverse myelitis, which I'll call TM, and Guillain-Barre, which I'll call GB. In motor changes, you'll have early flaccid and late spastic paralysis in TM. If the patient's quadriplegic, you'll have weakness in the lower extremity that's equal to the upper extremity. In GB, you'll have ascending paralysis. The weakness in the lower extremity will be greater than the weakness in the upper extremity in early disease. In terms of sensory loss, in TM, you'll have a clearly identifiable sensory level of sensory loss. In Guillain-Barre, you'll have mild sensory loss and often no spinal cord level that is clearly defined. In terms of autonomic dysfunction, in TM, you have bowel and bladder dysfunction. In GB, you have cardiovascular instability. No cranial nerve problems in TM. In GB, you'll have oculomotor, glossopharyngeal, or facial paralysis. The EMG is normal in TM. The EMG shows peripheral motor and or sensory reduction in GB. The MRI shows a focal enhanced area of T2 signal in TM. As you can see in this picture down here, there's one very defined level on the spine. The MRI in GB is normal. Sometimes you'll have enhancement of anterior nerve roots or cauda equina in GB. The CSF in TM is pleocytosis. Sometimes you'll have increased IgG index. The CSF in GB shows absence of pleocytosis and elevated protein.